would like to invite Dr. KRISHNA TEJA. He will cover one size does not fit all, specialty contact lens fitting and customization. Dr. KRISHNA, over to you.
Good morning, everyone. Good morning, everyone. Today we'll be discussing about specialty contact lenses fitting and customization. Myself, Dr. KRISHNA TEJA. And there is a case scenario. This is a case scenario where a 61-year-old male patient, both eyes post-RK, came with a chief complaints of blurring of vision, and we checked the spectacle prescription, and his BCVA with the spectacle prescription was 618 in both the eyes. And in that person, we decided to go ahead with the scleral contact lens trial, and we gave him the scleral contact lens, and the patient improved to 6/9 in both the eyes. This is a diagnostic lenses trial fit frame, and coming to the scleral lenses, 4 parameters are mainly important. They are the sagittal depth, geometry, landing zone, and the power of the scleral lenses. This is a paper showing that approximately 60 cases were required before obtaining a significant reduction in the trial lenses and reorders of the scleral lenses. And coming to the scleral lenses can be divided basically into 3 zones. They are the central zone, the limbal zone, and the landing zone. Coming to the central zone, it is the main fluid reservoir. It has the main fluid reserve. And the most important of the central zone is the sagittal depth. And this sagittal depth can be assessed with the diagnostic lenses. To start with the sagittal depth, mainly the primary important ones are the topography and the formula. Topography can be normally taken, and there are formulas, and these formulas basically given by the lens fitting company as a fitting guide. So these formulas are mainly based on the Simke values, and the values obtained by this formula are not an exact fit, but it gives you a start. And this is a diagnostic lens fitting trial frame. And in this, the increase of sagittal depth from the left to right of the scleral lenses will be there. And if you are not sure where to start from the mid-range sagittal depth and customize the fit. If you are dealing with a keratoconus patient, go with a steeper lens, and if you are dealing with post-PK or any refractive surgery patients, go with a flatter lens. And coming to sagittal depth, diameter versus base curve, if the diameter is the same and if this base curve has been becoming steeper, then there is higher sagittal value. And with the same base curve, if you want to increase the sagittal value, you can go ahead with a larger diameter. And coming to the application of the diagnostic lens, a diagnostic lens is taken on a plunger, and it is filled with a non-preserved saline, and the saline is stained with a fluorescent strip, and then it is applied onto the eye. Then we go ahead with the assessment, fitting, and everything. So coming to the central zone, there should be a fluid reservoir of about 100 microns to 200 microns, and the fluid reserve is usually assessed with the diffuse illumination or a slit beam on a slit lamp. And this is a picture showing where there is a central low depth here, and the peripheries are fine. But this is the picture where which is showing that the fit is good. And the vault of the diagnostic lenses assessed by comparing the thickness of the scleral lens with the thickness of the reservoir. The slit beam is usually at 45 degrees angle. For example, if you take a lens of 400 microns, the vault should be 1:1 ratio, or about at least 80%. The settling of the lens also has to be kept on mind. This is a scleral lens fitting guide given by first Ferris State University. After this guide, the fitting of the scleral contact lenses has been drastically improved. And the reservoir can also be assessed with the help of an OCT, the anterior segment OCT. This is the most accurate method, and prefer to do OCT on the best fit lens rather than each and every trial lens. Coming to the scleral lens settling, there is a short-term and long-term scleral lens settling. And in the scleral lens settling, there is a loss of vault, and expect to lose up around 200 microns. And 50% of the settling occurs in the first 30 minutes of the application of the scleral lens. And most studies show that around 180 microns of clearance is there. And coming to the customization of the central zone, I am just going to play a video. Audio, please. Audio. So you have to put. Where is audio? Thank you.
The sag value determines the general vaulting characteristics from center to limbus. The range is from 3,800 microns to 6,600 microns in 50 micron increments.
Coming to the limbal zone, the limbal vault size should be around 25 to 75 microns, and the chronic wear of a low limbal vault, it gives us a limbal keratitis or neovascularization at the limbus, and it is a good thing to differentiate between a decentered lens and a tight fit lens. In the left, it is showing a tight fit lens, and here this is showing a decentered lens, and one quadrant of decentered lens is fine and acceptable. And coming to the diameter selection of the scleral lens, there is no clear consensus of the selection of the diameter, but greater than 16 mm diameter is usually suggested. With the increase in the diameter, there is more limbal clearance and increase in the sagittal depth. And the limbal clearance, usually the fluorescein stained central zone, and the limbal zone is usually seen with the help of cobalt blue light or white light or a slit. And the another method to assess the limbal clearance zone is the limbal OCT, anterior segment OCT. And there is customization at the limbal zone also, and I'll be playing a video on that.
The mid-peripheral and limbal values are sub-adjustments you can make within a specific sag value to achieve the desired clearance in those specific areas. Adjustment to the M and L values do not affect the central vaulting characteristics of the lens. They can be made independent of each other and in opposite direction when needed. The range of the M and L values is plus or minus 200 microns in 25 micron increments.
Coming to the geometry of the scleral lenses, some companies manufacture in such a way that one size fits all the geometries of eyes, and in some companies they produce different lenses for prolate and oblate eyes. And there is a small customization in the oblate eyes also, and I'm going to play a small video on that.
Use oblate geometries also give you the ability to control any excessive central clearance. Oblate geometries are derived from the regular prolate trial lenses. From your observations of the trial lens in situ, simply specify one of 4 levels of central clearance reduction values. The central clearance reduction is limited to an area of 7.5 millimeters in the center of the lens and does not affect the other vaulting characteristics of the lens.
Coming to the landing zone, depending upon the landing zone, there are 4 kinds of lenses: spherical lenses, toric, quadrant specific, and free-form lenses. The landing zone should rest evenly on the sclera. There should be no compression, impingement, or edge lift of the bulbar conjunctiva. Allow the lens to settle for 30 minutes after fitting there and reassess on the slit lamp diffuse light. And this is a picture showing here, this is a scleral lens, spherical scleral lens. Due to the toricity of the conjunctiva, there is here compression in these areas. So in such conditions, we would be able to go ahead with the toric lenses. Coming to lenses with toric landing zones, the companies provide toric landing zone diagnostic lenses also. The orientation is orientation useful for front surface toric and localized walls also. And coming to the asymmetric lenses, asymmetric conditions of the sclera, the quadrant specific designs or free-form lenses for asymmetric lift or localized impingement can be tried. There's a small video on toric and quadrant specific lenses. I'm going to play that.
When needed, due to conjunctival asymmetry, toric and quadrant-specific edges can be specified.
Once a best fit lens has been decided, we can go ahead with the contact lens over refraction. Spear cylinder over refraction can be done, and front toric surface lenses can also be customized, and the scleral contact lenses can also be customized with the wavefront customization. And coming to the future of scleral lenses, the profilometry is the future of the scleral lenses. Corneoscleral topography, shim-plug topography of the sclera and the impression techniques of the sclera gives us a good fit lenses. To conclude, one contact lens doesn't fit all the eyes, so different customization options are available everywhere, and we can take the help of the customization from the companies, and we can give the best vision to the patients. I thank everyone who has helped me during this process. Thank you.
Thank you, Dr. Krishna, for those basics of the fitting as well as the illustrative videos. That was really helpful in